Joy here, and you are watching Delivering Joy MD. Today, I have a super fabulous guest that you're going to absolutely love, and we are going to talk about provider types, especially the nurse practitioner, advanced practice professional. So, I know you want to get the tea on this, so make sure you keep watching. So today I want to introduce to you one of my girls, my nurse practitioner, Monica D, the NP. Say hey, Monica.
Hey, yes, this is Monica D, the NP.
Make sure you follow her on her YouTube channel and Facebook and Instagram and all the social media platforms, all of it. So I wanted to really kind of break down the nurse practitioner, advanced practice professional role. Someone actually asked for a video on this. They wanted to kind of understand what goes on, like when you go to a doctor's office or to a hospital and you're seeing a nurse practitioner or a PA or a CRNA or a CNM. We have like all these letters, like the whole alphabet soup in medicine, right? So I wanted to kind of break that down for you guys today, and I wanted you to meet my NP, nurse practitioner extraordinaire. And so when we talk about APPs or advanced practice professionals, we're really talking about someone who has received expert training on how to take care of patients in several different settings. So let's start at the top of the list. The CNM. Did I say that right, Monica? Yeah. CNM.
Yes, that's correct.
CNM stands for Certified Nurse Midwife, and obviously a midwife is a person who specializes in maternity care. Midwives may also do OBGYN services in the office as well. And then a CRNA. Yeah, I'm terrible remembering these letters. CRNA stands for a Certified, what is it?
Nurse.
Certified Registered Nurse Anesthetist. Yeah, that's it. Certified Registered Nurse Anesthetist. So these are nurses who have gotten additional training in like helping to provide anesthesia for procedures. And then moving on, you have your NP, which is what Monica D is. And the nurse practitioner is a registered nurse who has gone through additional academic training as well as clinical training to be able to do minor procedures, help physicians in the hospital or in their office, and take care of patients pretty much independently. But the final APP is a PA. So PA stands for physician's assistant, and they also can fill the role very much like a nurse practitioner of seeing patients in the office, in the hospital, assisting with surgeries. So all of your APPs are folks who have the capability to take good care of patients, especially if they are not really high risk patients. So say if you're just going for your annual physical or your annual pap smear, or you just have a cough or cold, something like that, the APP could certainly take care of it. And many APPs manage really complicated patients as well, like in a cardiology unit in a hospital or an ICU. So I wanted to just kind of like let my girl Mo here tell you all about what she does in a day. Take it away, Monica D.
So yes, as a nurse practitioner working in a OBGYN office, my day-to-day clinic is seeing annual exams. So I'm able to do annual exams, do your pelvic exam, pap smears, talk to you about the many different birth control options. And if you can choose a Mirena or an Nexplanon, I'm able to put those in and also take those out for you. I'm also able to do STD screenings, talk to you about safe sex practices, family planning, when it's time to have a baby, what you need to do, infertility options, as well as if you're having trouble with your menstrual cycle, we can talk about how to get it regular, what we may need to do, what other procedures you may need. And if you may need surgery, then I would refer you to the lovely Dr. Baker over here. And being an OB, I'm able to also see you while you're pregnant to do some of your prenatal care as well.
So Monica is like my right hand. She takes care of patients with me every day. I trust her clinical judgment. And what happens in our relationship is that I have to review a certain number of her charts. So the doctor has to kind of just make sure that they're keeping track on what's going on in terms of the patient's treatment plan. So, you know, when you're seeing an APP, there is always going to be a collaborating or a supervision, supervisory physician who is making sure that APP has the support that they need. So if there's a question about something in a patient's care, like Monica could just be like,
I always text or call, or she's in the office, I'll go up to her, ask her opinion or what to do, or we need referrals.
So we kind of have like this really symbiotic relationship. She asks me questions, she helps me out, and so APP is really what's called a physician extender, and the physician extender just basically gives me more reach, so it helps more patients be able to come to our practice. Monica is able to write prescriptions and to do some minor procedures, and really is a huge help in the office, and it just kind of keeps physicians from burning out. So if your doctor's office has APPs, those are really great. So don't be afraid to see the APP. They usually are going to take really good care of you.
Come see us.
So, girl gang, now you know all the tea about the APPs. Thank you so much for watching, and tune in next visit where we're going to talk to you about the difference between a pap smear and a pelvic exam. Ooh. Bye, girls. Peace out.
See you soon, girl gang. Don't forget to subscribe and comment below.